Hello, my name is Emirjona Kiçaj. I'm a lecturer at Faculty of Health, University Ismail Qemali, Vlora. My presentation is titled Evidence-Based Medicine Research Related to Quality of Care for Diabetic Patients. According to World Health Organization, in 2019, diabetes was considered the leading cause of 1.5 million deaths, 48% of which occurred before the age of 70. In 2021, 1 in 2 adults with diabetes were not aware of their health status. To prevent complications, avoid a premature death, and improve quality of life among diabetes patients, it's important for them to be diagnosed as soon as possible. Quality of care is the level of health services for individuals and populations to achieve the desired health outcomes based on evidence-based knowledge. So, when we talk about the quality of care, we mean the promotion, prevention, treatment, rehabilitation, and this quality of care must be measurable and in continuous improvement to meet the needs of patients, family, and community. A quality health service should be effective by providing evidence-based health care, safe by not allowing harm to the people for whom this care is given, people-centered, responding to individual preferences, values, and needs, at the right time by reducing the waiting time, equal and integrated by provided care throughout all life courses. The aim of this study was to identify the best practices followed in terms of care for type 2 diabetic patients. During the period May-June 2022 was conducted an electronic research of studies published in PubMed, MEDLINE, etc. This research was focused on identifying studies in healthcare for diabetic patients only with type 2 diabetes. The keywords of this research were quality of care and type 2 diabetes. As inclusion criteria were we have included in these studies only analytic studies, studies that have evaluated patients with type 2 diabetes or healthcare providers to these patients, and studies that have been published only during 2017-2022. In the end, we have analyzed 78 studies. In this graph are presented studies included in this review. The largest number of studies included in this review were studies conducted in the United States of America. 2 studies included in this review are conducted in the Albanian populations, provided comprehensive patient-centered care to prevent or delay the onset of diabetes complications and to treat diabetes and existing complication was the most common focus of the included studies with 20 studies, followed by patients' education and support with 18 studies, the role of diet and physical activity with 13 studies, use of technology as a method to improve health management in diabetic patients with 11 studies, diabetic preventions with 10 studies, and the role of diabetes self-management and support system on management of diabetes only with 6 studies. In education and support group, there were 18 studies. All studies identified the importance and effectiveness of health educations in terms of improving the health of diabetic patients. 3 of them identified the role of inclusion of educational programs in terms of specific exercise in health care for diabetic patients. 5 studies have explored the role of nurses and have found that nurses should be included in educating patients to manage their disease. All these studies concluded that programs such as individuals nursing education and health education, plus usual care program, diabetes transitions of hospital care program, diabetes self-management and support program, integrated care programs were efficient. The second group of these studies talk about adherence to diet and engagement in physical activity as an important component for improving the health of type 2 diabetic patients. 30 studies conducted during the period 2017 to 2022 which have identified the impact of structured diets or physical activity in diabetes management. These studies were mainly controlled trial studies, 1 was cohort study and 3 were crossover design studies. All studies reported concrete improvement in diabetic patients. 6 studies focused mainly on specific physical activity programs. These studies evidence the effectiveness of some type of exercise like resistance exercise, aerobic training, healthy walking in reducing the level of glucose hemoglobin in diabetic patients. An important role in improving the self-management of diabetic patients has the correct implementations of healthy diets. There were 7 studies which focused mainly on diet modifications by increasing fiber intake, low-fat diet, carbohydrate, ketogenic diet, leguminous diet, or low-calorie diet. We can say that these studies show that following plant-based diets helps keep glycemic levels under control among diabetic patients. There are 6 studies that show that patients want to follow support programs, but with the help of healthcare professionals, they increase their adherence to these programs, thus improving their diabetic management. These 6 studies present the effectiveness of changing, expanding, or integrating the role of healthcare professionals to improve diabetes care and outcomes. All studies reported concrete improvement in diabetic patients. These studies evaluated the role of nurses, pharmacists, even psychologists on support of patients to improve their self-management. Another group included in these studies talk about provides comprehensive patient-centered care to prevent or delay the onset of diabetes complications and to treat diabetes and existing complications. There were 20 studies included in this part of this review. All the studies in this group concluded that patients who participated in specific programs for food care or eye care show better control of preventions of these complications. Training of nursing staff regarding diabetic food care improves their care practices for diabetic patients at risk for diabetic foot. The application of health education of diabetic patients in the direction of preventive or therapeutic care for diabetic foot has a great role in the self-care of diabetic patients. These studies have evaluated programs like food care programs, step farm programs, one-to-one education for high-risk cases for diabetic foot. 3 analyzed studies present the importance of applying different programs in the directions of educating diabetic patients about eye care. We can talk about 2 programs in this evidence-based practice. The first one was applying the theory of plant behavior, and the second one, a well-designed eye health and retinal screening promotion leaflet. Often diabetic patients do not seek and are not oriented to receive services for eye problems. This is especially noted among older patients. Delivering a supportive educational intervention on outpatients diabetic clinic can decrease the symptoms and severity of diabetic peripheral neuropathy. Glucose hemoglobin level variability is associated with increasing incidence of nephropathy, while mean glucose hemoglobin level emerges as an independent risk factor for the development of retinopathy and peripheral neuropathy. Another aspect of this review was technology such as web intervention, weblogs, or telemedicine used in improving health management for diabetic patients. Patients who used web technology tended to have better control in diet quality and cardiometabolic risk factor reduction. The recommendation in this area is that teleeducation should be combined with face-to-face educations of patients by healthcare professionals. According to the literature about diabetes preventions, the main conclusion is that all the interventions that were similar to DPP integrated lifestyle educations were efficient. There were 10 studies that recognized as diabetes prevention studies. These studies were cohort study, randomized clinical trials, cross-sectional studies, and longitudinal studies. All these studies reported significant improvement in preventions of diabetic type 2, self-directed lifestyle modifications, and glycemic control and anthropometric parameters. This review and this 78 study analysis show that there are easily applicable strategies to promote and protect the health of the diabetic patients. Numerous studies have shown that educating and supporting diabetic patients is much more effective if provided by a multidisciplinary team. Diabetes educators can be from many different disciplines, including here nurses, pharmacists, even psychologists. Diabetes educations can improve the quality of life of diabetic patients and can also prevent the cost of long-term complications among these patients. Most of the studies, including in this analysis, highlighted the importance of health educations of diabetic patients, education that affect a good self-management of the disease and lifestyle changes. If this education is provided by primary health care services, can be much more effective. Diabetes is a chronic complex disease and, if not well managed, can bring unsatisfactory results for the patients or the health system. Improving organizational capacity in health systems would make it possible for us to make use of the best care practices. Group work, use of technology, use of care protocols would help the diabetic patient to better manage his health. But evidence-based medicine should not diminish the importance of human relationships or ignore the fact that clinical decisions in primary care involve considerations of the unique problems and concerns of individual patients.